What are you being told about the hospital's preparedness right now? And when it comes to Sturdy, what keeps you up at night?
Okay, so Sturdy is a great community hospital, and I had a call with them last week with the CEO, Joe Casey, and Dr. Patel, who's the Chief of Emergency Medicine, and there's a few others on the call, some of the other board members, the chair of the board of directors. And Sturdy is in a position where it's ready to do what it has to do. I would say most of the comments and questions about Sturdy should probably be referred back to the Sturdy Hospital itself. But they're an excellent hospital, and they've asked me, in my capacity as mayor, that if people want to go to the hospital, to probably call ahead in advance, to let them know if somebody suspects they may have coronavirus, to call ahead in advance to let Sturdy know, so that way they can receive the person properly.
There was a student that was being tested that caused a quarantine for the schools in your town. What can you tell us about that student?
That student has since been found to be negative for coronavirus, which is good, and that's comforting to a lot of people who went to school with this student. It was Coelho Middle School in South Attleboro.
What's your biggest worry, Mayor?
Biggest worry would be something like half of the police department being unable to do their job, or half of the fire department, or half of the wastewater department or water department. And last week I called together an emergency meeting of those four department heads, as well as the health department, the personnel department, and the school department, to contingency plan and to make sure that if that scenario happens, how are we going to continue to operate those four essential departments? And actually, I should also add that the Department of Public Works becomes an essential department when there's a snowstorm, because the DPW has to remove the snow to allow the police and fire to get to the people that need them. So those four departments plus DPW, they are in a place where if they had to have 40, 50, 60% of their workforce stay home or self-quarantine or self-isolate, we can continue to get those essential city functions accomplished, to protect the citizens and to keep them healthy and safe.
And how would you do that? Are you working with neighboring communities, going, hey, look, if my police department gets hit, can you provide coverage to my city, and vice versa if you get whacked?
So a couple different things. One thing we would do with our police force is, if let's just say 50% of the police force was out, we couldn't have them come in. We would move from 8-hour shifts to 12-hour shifts, and we would be hooking people for a lot of overtime. We'd also try and set something up within the police department to help with giving them food, a place to sleep, because then they might need to crash for a little while. The fire department, they already have food and sleep capabilities. Fire departments always use mutual aid when necessary. So if we had a reduced fire department, we would basically be in a situation like we are today. For example, in Pawtucket with the mill fire just recently, there was mutual aid coming from all over the place, because that was something beyond one fire department's capabilities. So with water department, they are able to operate with one person at the department at a time, and then operate the rest of the department remotely. Wastewater is a little bit different. Wastewater is a much bigger department than the water department, and a lot of that is mechanical in nature, so we could have supervisors or people who are certified and licensed with certain certifications, instructing people how to do what they need to do. I think that in this time, if we were in a place where we didn't have the proper licensing for like water department or wastewater department, I suspect that, and I would hope that the Attorney General's office would probably come down on our side and said, the city did what it had to do to keep the water department and the wastewater department moving. Now, a lot of people don't think of water and wastewater when they think of municipal government, but without water, virtually no other department is able to function.
Right.
And if we turned off the switch to the wastewater department, within 5 minutes, people are going to have raw sewage going up through their sinks and their bathtubs, and that's becomes its own new public health crisis.
Forgive me if we've been covering a lot of different communities. Have you declared a state of emergency in your city?
No, I haven't. And in my case, if I were to declare a state of emergency, that's not going to really do much for us in this situation. It would allow me to deficit spend beyond what we have in our normally budgeted line items, and then I would have to later go back to the city council and request money for that. So I've done that once in my 2 years and 3 months as mayor. That was during a snowstorm. I had to declare a state of emergency so we could deficit spend to pay the overtime for the snowplow workers, and that would be similar in this situation. I would have to pay overtime to police, fire, and water and wastewater. Another thing is that if I were to, this was actually a rumor. Another capability that the mayor has, which I am not even thinking about, not entertaining, not categorically, is a curfew. A curfew is only good for 72 hours. And that's all I'm allowed to impose a curfew on, and that's only used for civil disobedience and civil disorder, neither of which would be useful in this situation, because we don't have civil disorder or civil disobedience, and we also don't have a virus that would limit itself to 72 hours and die out within 72 hours. It lasts for weeks. So a curfew would do nothing for us, and there was a rumor circulating about that. I could petition the governor for the National Guard to help us out, but there is no reason for that right now here, and I don't see that happening anytime in the future either.
Final question for you, Mayor. You were a lawmaker, so you understand Beacon Hill. Have you reached out to the delegation in your area or to the governor himself? And if so, what are you asking for? What do you need?
Yeah, so I've spoken with both the state and federal delegation. I've spoken with Joe Kennedy directly, and Elizabeth Warren's office has reached out to me, and Ed Markey and I have text messaged back and forth a little bit. And what I asked them for was, at the federal level, if we are in a situation where we do have half of the police department out or half the fire department, and we have to be spending hundreds of thousands of dollars on overtime to keep those operations going, to provide FEMA money, to advocate to the administration, to provide reimbursement to communities. So that's what I asked the federal government. At the state level, we've been in contact on a regular basis. I've had multiple video meetings and video conferencing with the 4 state members of the delegation. Attleboro is represented by 2 state representatives and 2 state senators, and they don't overlap with their area. It's just Attleboro happens to be split because it's 26 square miles and it's 45,000 people. But with the state delegation, they're also doing what they can to make sure that issues like surrounding unemployment are going to be addressed at the state level, because if we shut down we shut down the building for the Career Center. If people have to declare unemployment or go on unemployment, they have to actually connect with Career Center before they're eligible for that. So waiving certain requirements like that. So the state delegation has been excellent with their outreach as well. In fact, I think that right now, you might want to follow up on this, State Senator Becca Rausch, she's looking to the governor to declare some type of shelter in place for the entire state. And she's, that's something I just heard about within probably the last half hour.
Do you support that?
It depends on what would happen. It depends. So a shelter in place is nothing we can actually enforce. That's sort of a recommendation that we give to the citizens that would hopefully be followed by them if we felt that particular tool would help decrease the spread of this virus. Shelter in place is not martial law, for example. It's not like we'll start arresting people if they are seen out. And we're a city of 45,000 people, and we only have 100 police officers, so there would be no way to effectively enforce that anyway. And people still need to go to the grocery store. They still need to go to the pharmacy. There's still some businesses that are in full operation, even though they probably, in my opinion, they should scale back on some of their operations. But the shelter in place, we would have to look at, is that tool useful for this community? When we were a border state border city with Rhode Island, we also, if Rhode Island was not doing that, that would minimize the effects that a shelter in place would have. We'd also have to, consider, how long that would go on for and what people are prepared for. So the biggest issue is, are we a community right now, as Attleboro, of our 45,000 people, would a shelter in place help slow the spread of this virus? And if there are virtually no cases of it here anyway, and it might not have any effect, it might not do anything for us. So it all depends. I mean, that's something I would take up with the health department and our health officer.